Good morning, everyone. Today, we are presenting our analysis of computed tomography physics and instrumentation, specifically focusing on the critical role of slice thickness in clinical practice. My name is Umu Ifa Izzati, and I'm joined by my partner Muhammad Sharufitri. In CT imaging, slice thickness refers to the width of the tissue volume being scanned along the z-axis. It serves a fundamental gatekeeper for both spatial resolution and noise. Our goal as radiographers is to optimize this parameter to follow the ALARA principle, which is keeping radiation as low as reasonably achievable while ensuring diagnostic image quality.
To understand slice thickness, we have to understand the voxel. While a pixel is a 2D, a voxel is a 3D, and its size is determined by field of view, metric size, and slice thickness. As shown in the formula, adjusting this setting changes our spatial resolution. Smaller slice thickness allow us to see finer details along the longitudinal axis. However, if we use slices that are too thick, typically over 3 mm, we encounter partial volume averaging. This happens because the computer average different tissue densities within one large voxel, which can obscure small lung nodule or hairline fracture. As you can see in figure 2 on the slide, a 1 mm aperture provides much clearer anatomical detail than a 7 mm aperture.
Now, you might think, why not always use the thinner slice? The reason is the signal to noise ratio or SNR. Thinner slices capture fewer X-ray photons per voxel, leading to increased quantum motile or graininess. For example, while 1.25 mm is ideal for identifying small bone fractures, a 5 mm slice is often preferred for abdominal scans where high contrast between soft tissues is more vital than fine details. Next, this leads us to a major challenge, which is the dose noise trade off. To maintain an adequate SNR when using thin slices, we often must increase the radiation dose, which is the MAS. This fills those tiny voxels with more photons, but it raises the patient's exposure to ionizing radiation. For instance, using a 0.625 mm slice instead of a 2.5 mm slice might result in a 40% increase in radiation exposure.
A major shift in 2025 is the clinical application of deep learning reconstruction of DLR. This uses artificial intelligence to mathematically detect and eliminate noise, dissolving the link between high noise and thin slice. With a DLR, we can reconstruct ultra-thin 0.5 mm slice while maintaining the radiation dose of thick slice can potentially reduce exposure by up to 44%. So now I want to talk about alternative solution and workflow. There are other solution too. Iterative reconstruction (IR) is a widely used method that reduce noise compared to the older technique. Through it, it can create a wax-like texture at very high level. Additionally, simply ensuring correct correct patient position prevent automatic exposure control system from miscalculating dose. One downside to remember, thin slice create massive dataset that increase storage needs and radiological review time.
Looking ahead, Future AI systems may use patient-specific data to dynamically modify slice thickness and dose based on the organ being scanned. We are also seeing the use of generative adversarial networks, which is GANs, for slice interpolation, generating high resolution intermediate slices to reduce scan time and dose. Finally, AI will soon provide automated quality control to standardize performance across institutions. In
In
conclusion, slice
conclusion,
thickness is a
slice
fundamental to
thickness
CT
in
physics,
fundamental to
determining
CT physics,
the balance between
determining the
resolution and
balance
noise.
between
While thin
resolution
slices
and noise.
provide
While
uncommon
thin
detail,
slices
their use
provide
requires
uncommon
advanced
detail,
AI-based
their
reconstruction
use
to
requires
stay within
advanced
safe
AI-based
radiation limits.
reconstruction.
As
To stay
radiographers, we
within
must
safe
customize
radiation
every
limits.
scan to
As
prioritize
radiographers,
patient
we
safety
must
and
customize
image
every
quality.
scan to
Thank you.
prioritize patient
We
safety
will
and
now
image
move into
quality.
our Q&A
Thank you.
session. We will now move into our Q&A
In
session.
conclusion,
Slice thickness is a fundamental. According to the research findings, what is the primary relationship between CT slice thickness and image noise?
The answer is inverse relationship. As slice thickness decrease, fewer X-ray photons are captured per voxel, leading to an increase in image noise.
Next, which effect occurs when thicker slices, example at more than 3 mm, average the densities of several tissues within a single voxel, potentially obscuring small abnormalities?
The answer is partial volume effect. This effect occurs when multiple tissue types occupy the same voxel, leading to an average density that can hide fine detail.
Based on the formula provided in the report, what parameters determine the dimension of a voxel?
The answer is D equal to FOV divided by metric size. Voxel size is directly derived from field of view divided by the number of pixels in the metric.
To maintain an adequate signal to noise ratio SNR when using thin slices, what typically happens to the radiation dose, which is MAS?
The answer is it often increase. Higher MAS is required to fill smaller voxel with enough photon to keep noise at a diagnostic level.
What is a major advantage of deep learning reconstruction DLR mentioned for the 2025 clinical environment?
The answer is it allow ultra thin slice without a dose penalty. DLR use AI to remove noise, allowing higher resolution imaging at much lower radiation doses than conventional method.